Well, you're a hardy group, and for still being here. I think we can all agree it's been a busy couple of days, but as busy as it has been, I hope you agree that it's been informative and even more importantly, encouraging. Informative and encouraging. And my job over the next few minutes, and here's the good news, I'm the caboose. This is it, I'm the end of the line. It's over, that's all plus. And the other really good news is everyone knows I don't talk much, so we'll be done in no time, just hang on. But my job at the end of all this is to sum up what it means. What we've learned over these first 6 years that we've shared with you today, what it means. And it turns out that's going to be pretty simple. And I can do it in a single slide, and it will be an important message, a really important message. But before I get to that, I have a lot of thank yous that I have to, that I am enjoying the idea of making. The first is I want to thank our growing network of outstanding clinical scientists. We know that you folks are on the front line taking care of patients and families, dealing with administrators and insurance and all the other silly stuff that you have to do. And we deeply appreciate your willingness to work with us. We learn every day from our investigators. Our experience, our knowledge, and our lives are enriched by those interactions, and you saw a lot of them over the last couple of days. And it's just to be surrounded by people who know their work and their space and commit to the patients and have the knowledge that makes way up on this stage is really kind of a remarkable, not kind of, a remarkable is for me. And a special thanks to our friends and colleagues at Biogen. Biogen was a founding donor and has continued to be a strong supporter of n-Lorem from day one. And they've hosted this meeting for the last several years since we started having it, and they're going to continue hosting it, and they've also just told us of another generous gift that they're giving us. And so we owe Biogen tremendous debt of gratitude. I think it reflects the fact that Biogen is committed to leaving no patient behind. So if you're looking for a stock to invest in, I recommend Biogen. I want everybody who buys Biogen stock also to buy Iona stock, because I still have a lot of Iona stock. I shouldn't do that, I guess. Anyway, we really thank Biogen, and you know we couldn't afford to do this if it weren't for Biogen. And this meeting is so important to get everybody together and to share these moments with each other. Thanks again to our friends at Biogen. And thanks to two of our manufacturing partners, Hong Genes and Chem Genes. You'll notice that most of these manufacturing companies have genes at the end of their name. I'll take credit for that. Thanks to me, they can have their genes at the end of their name. And of course, Hong Genes and Chem Genes supported the reception for patients and families. And that's a really nice time, especially for us at n-Lorem, because it gives us a chance to just say hi in a different environment. And we have a good many sponsors of this meeting. And these sponsors help us fund this and also help us help patients and families travel here. Special thanks to Luke Rosen and Rescue 7 for being here again this year, taking care of the kiddies and being here in case we need them. Heaven forbid, but it's really comforting to know that they are here. So thanks to all of that. And this page is going to end up being now 2 pages or 4 pages or 10 pages. This is just a list of the sponsors, the donors, the individual donors, the patient-centered donors, the growing list of commercial partners that we have. It's been incredible. One of the great joys of doing this for me is to see how big the hearts of people can be. And we've been overjoyed with the expressions of kindness and generosity that we get to experience every day. And of course, I thank our speakers and panelists. Of course, these people get invited to go to 100 meetings a year, and I have never had a speaker or a panelist I asked to come to this meeting who said no, unless they had an immutable conflict. Sessions Cole couldn't make it last year because it was his 50th anniversary. I just couldn't believe that he wouldn't come to here instead of going with his wife on a cruise, but you know, okay. I've forgiven him. He should know that. So these are really senior folks that you get to listen to, and they bring decades of experience and knowledge that is really unparalleled. And thanks to our patients and families who've made the trip here, participated in this, shared their stories. You're why the meeting happens. You're why we come to work every day. And of course, thanks to the audience. It'd be a pretty lonely meeting if we had nobody to talk to. Roseanne will tell you I'm pretty good at talking to myself, but even I get tired of that every now and then. So thank you, everyone, for being here. You know, you've probably heard my colleagues and me say we're privileged. And we say that because we mean it, but I worry sometimes that it seems so glib that it may not express fully what we're talking about. And I think we can all agree that all diseases are unfair. They're imposed on us, almost, it seems, whimsically. But I think nano-rare diseases take unfairness to an art form. We know that all of us are walking around with hundreds of millions of mutations. And our loved one has the same number of mutations, but the bad luck of having a mutation at a particular spot in a particular gene that drives this enormous phenotypic change that we call terrible disease. That's an unfairness that just seems intolerable. It's intolerable to me. And I don't have a loved one affected by one of these diseases. And whether a disease is common or rare or nano-rare, the response to a disease is primal and it's universal, and we all go through it. And the first, of course, is this deep, visceral, kicked in the gut fear. My God, what does this mean? Is my loved one going to suffer? Could my loved one pass away? What's next? How do I help? What do I do? It's a terrible fear, and we all live with that fear. And then we react to the unfairness, and it's every bit as primal and universal. You know, studies show that by the time you're a toddler, you can identify when you're being treated unfairly, independent of culture or anything else. By the time you're 18 months, you know when you're being treated unfairly, and you react with anger. And that's reasonable, primal, universal. And so we react to the unfairness of it. And the natural response is anger. And we quickly learn, though, that there's no place to put that anger. There's no thing to blame, no body that we can find. And so good people know that anger and bitterness just make things worse. And so they go to work. And this is what we watch. We watch human beings dealing with the worst that life can give them. adjust their dreams and expectations for their loved one. They no longer think about their loved one playing football. They think about lesser dreams, lesser expectations. And in almost all cases, they have to adjust their dreams and expectations for themselves, for their family, in so many different ways. And we watch that. And still, good people find the positives. They take great pride in what their loved one who's afflicted accomplishes, and they scale back their expectations for themselves, but even then they take pride in what they do. And we see that. And eventually, they focus outward. And my goodness, you heard it so many times. What can we do to help others? I can't tell you how many times in my career I've had a patient say to me, you know, I don't really think this experimental medicine will help me, but maybe what's learned by studying me will help others. I can't count the times I've heard that, but I will tell you I cherish every moment, every single time I ever heard that, and I heard it a lot. So we see that in the people we deal with. So I guess, in short, we experience humans at their best, expressing their noblest self. And that's a privilege, and we thank you for that. My limitations are many, and I'm not eloquent enough to really describe what I'm trying to say. But, you know, if it's worth saying, it's almost for certain it's been said better already by a poet. And in this case, it's a poem that many of you will know, and many more will know the title, because it was the title of a wonderful movie about Nelson Mandela. And the title of the poem in the movie was Invictus. Anybody see that movie? If you've had a chance, it's a joyous, wonderful, wonderful movie. Recommend it. Invictus was a poem written by William Ernest Henley in the 1800s, mid-1800s. And it's got many, many verses, but the heart and soul of the poem is the first and the last verse. So see if this rings true for you. In the 1850s, Henley wrote this. He wrote, "Out of the night that covers me, black as the pit from pole to pole, I thank whatever gods there may be for my unconquerable soul. No matter how straight the gate, or filled with punishments the scroll, I am the master of my fate. I am the captain of my soul." I think Henley would say, when we experience you folks, we experience Invictus, unconquerable human souls. That's a privilege. We thank you for that. So night really can come unbidden. And it can be as black as the pit. And many, many people in this room have experienced that. We can't control that, but we can control how we respond. That's Invictus. That's the unconquerable soul of humanity. We thank you. So we have, you know, incredible privileges at n-Lorem. We experience human beings at their best, experiencing the worst that life can give them. And then, to help them, we get to practice leading-edge science that we believe will change health and the way we think about disease and medicine altogether. I mean, what more could you ask if you're a scientist? I mean, just joyous about the science I get to do every day. It's just, can't tell you how wonderful it is. And then we experience the power of hope. Most of the families that make their way to us arrive without hope, hopeless. And we don't make promises, we can't. We say, we think, maybe, we hope, perhaps we'll be able to help. And we see the power of hope, and you can watch it in the posture of people. It's as though they're more erect. There's this enormous weight that's lifted off. Hopelessness is a terrible, terrible state for human beings. No one should be hopeless. No one should be hopeless. And we deliver hope. And then we get to experience real joy when we see the benefit that our medicines bring, not just to the patients, but to the families and to the community. What more could you ask? So when we say we're privileged, it's not glib. It is heartfelt. Heartfelt's a very, very charming term, isn't it? Heartfelt. You know, our heart to your heart. Maybe that's all I should have said, but heart to heart. So n-Lorem is an exercise of the mind informed by the heart. Let's talk about dreams for just a minute. From my perspective, there is only one skill that consistently, unequivocally separates humans from other species. And that is that we can dream collectively. That's an amazing skill. And I say only, but that single skill has reshaped our planet, has reframed our understanding of the universe and our place in it, has reshaped our understanding of how we work, why we fail, what we can do about it when we fail, and reshaped the present and is framing the future. And collective dreams, to my mind, happen the same way every single time. There is a person who sees the world as it is, and as the world as he thinks it should be. That's a dream. A dream by itself is essentially useless. But that individual has the dream and a plausible plan that could make the dream a reality. I used to think it had to be foolproof, but I've learned over the time that I've been living my career, and I think of my career as just being a dream merchant, that most people don't believe it's likely. Just as long as it's plausible, they'll take a chance. So that combination of the dream, the plan, and the dreamer is galvanic enough to recruit others to work toward the dream. And of course, collective dreams don't just happen. They're willed into existence by hard work and perseverance through skeptics, cynics, naysayers, disappointments, challenges, failures, and all the mistakes that you make when you try to do something that's never been done before. And we in this audience share a collective dream. We dream of a future in which all nano-rare patients are rapidly diagnosed and have access to effective treatment. That's a dream really worth working toward. That's a dream that we can persevere through all kinds of challenges. That's a dream worth dreaming and working and building toward. And we've done what we've done because we dream together. So our dream is focused on the future, but the work we do is here and now. You know, I say great, let's solve the problem in the future, but what about the patients today? What about the families in need today? And I firmly believe that the best way to create the future we dream for is to demonstrate value over and over again today. Yes, we can do this safely. Yes, we can bring benefit to patients. And yes, we can deliver value. And as we do that, we create the tip of the spear that drives more fundamental, more holistic change. And that's what we're doing. And that's what you've heard over the last 2 days. And so, you know, as a veteran dream merchant, I'm used to people saying, you can't do that, that's impossible, that'll never work, and I've gotten very good at ignoring them. And so, yeah, no, there's no way you can do a nonprofit and just give drugs away. It can't be done. Yeah, no, we've done it. We can do it. And there's no way you can discover a drug for a patient in less than 15 to 20 years. No, we can start and finish and have that first dose in a patient in 18 to 24 months if we have the resources to do it. We can do it. And we can't possibly develop a drug for less than $3 billion or $2 billion. No, we actually are. It's costing $1 million, and tomorrow it could be much, much lower as we treat more and more patients with the same ASOs. Yeah, it costs us $1 million to make an ASO to treat 1 patient, but if we use that same ASO to treat 10, it's $100,000. And if we treat 30, it's $30,000. Imagine a life for $30,000. Imagine a life for $1 million. What's a life worth? Well, a lot more. And we're going to be reducing that cost. You know, when we first started, the FDA worried a lot about whether we were going to treat more than 1 or 2 patients. Today we have INDs where we're treating 10, 15 patients. And all of that's a product of the good work that we've already done. And so we're very optimistic that we'll be able to treat expanded patient populations that with the same ASO and bring our cost structure and time structure way down and use those ASOs around the world. And no, of course, we can't produce an industrialized system that can scale to meet the needs. You know, we've treated 95% at least of all the Nano-rare patients treated to date, and we'll treat more tomorrow. And there were many people who said that single patient data wouldn't be of high enough quality to be of any value. And the modified crossover design that you've seen now is generating valuable data that's reproducible and is teaching us, yes, about these mutations, those genes, nano-rare patients, but it's teaching lessons about health and disease altogether that are going to apply to all of health and all of disease. And I think Andrew convinced me, I hope he convinced you, that we're making solid progress in creating a community, a knowledgeable community for nano-rare patients. There was no community 6 years ago. There was none. And we can bring attention to the needs of nano-rare patients. And we're beginning to see that. We haven't really talked about it because it's still pretty nebulous, but there is a real movement toward finding more holistic solutions that could lead to commercial paths for these drugs, which is the ultimate, you know, realistic long-term solution here. And we are set to participate in that and ready should that ever happen, and we know what we will do in response to that. We've also shown that there's no disease so advanced that we can't bring benefit. You know, 6 years ago, I would not have thought that many of the patients that we've seen get better had any chance of getting better. It just didn't seem at all possible to me. And we can treat diseases not just in the central nervous system, in the liver, the kidney, and the eye. We began to see, to save the sight of a patient like Grace. How much value is that? Hard to imagine. And for the first time, we know with ASOs we can reduce neuropathic pain. And I just am amazed that we could see peripheral nerves growing in a patient. Maybe that's the only time we'll ever see it. Maybe it's, we'll have to find out if it happens over and over again. But just seeing it once is an astonishing event. And we can fix autonomic disorders. That opens up a whole series of problems that we didn't know ASOs could fix. And you saw in the various presentations and in the developmental delay conversation with the world's experts that the key message is we have to discard all our preconceptions that were, if you had a developmental delay, that was it, that was forever. That's all gone now. It's all gone. We don't know, which is a good thing. We know that we can do way more than we thought. And we're seeing long-term benefit. Susanna is now 3 years. We have more than 10 patients over a year. And so even as advanced as these diseases are when the patients make their way to us, there's still long-term benefit to be realized. We didn't know that 6 years ago. I certainly didn't think it would be likely. And we can do it safely. And it takes real knowledge, real experience with the technology, real respect for drug discovery and development, and caution, above all caution. So what's the take-home message that I take away from these 6 years? This is a slide that I've thought long and hard about because to give false hope would be the cruelest thing possible. But I think an unbiased look at the information that we've presented and we've observed over these years really just leads, there's only one conclusion you can draw, and that is we can hope for more and we can dream bigger dreams. We can hope for more and we can dream bigger. My goodness, what more could you ask for 6 years? Yeah, well, how big? How much more hope? I don't know. It'll be years before we know that. But I know that the hopelessness that I had is all gone. And so the message that I want you to take, and I think our data support, is that there's every reason to hope for more. There's every reason that your dreams can be bigger. Hope for more, dream bigger. Of course, we haven't done it alone. We've had the support of the FDA. I can't emphasize enough the central importance of the FDA. We've had so many donors, individual donors, disease-focused donors, our CMO and CRO partners in this growing list of commercial partners. And we've had our patients and families to motivate and cohere us to purpose. It wouldn't be possible to do this if it weren't for you and for the motivation you provide. And you ask what's left, what impossible barrier is left? There is none. We have a single challenge, raising the money to expand to meet the demand. And I'm very confident that working together, that's a problem we can solve. That's fairly trivial. When you think about, we solve the scientific problems, we solve the technological problems, the regulatory problems, the administrative and systematic problems, the clinical trial problems, they're all behind us. All we need is a little money. But it's going to take all of us. If you're on the sidelines, I would ask you to get in the game. Every dollar matters. Everything that you can do to help us will matter. And it will matter to more than just your family. It will matter to families around the world. And with that, I want to thank everybody for your participation in this meeting. I hope it's been as informative and joyous for you as it has been for me. Thanks. Good night.